There's something special about sunshine that makes us live longer, even after accounting for skin cancer. Sunshine reduces the rate of death from a number of conditions. Let's take a look at a Swedish study, and it compared those with a history of sunbathing vacations compared with those who had never been on a sunbathing vacation. And what they found was that there was a statistically significant trend for lower mortality in those who had been on sunbathing vacations. This was also a Swedish study, and it looked at almost 30,000 females over 20 years, and it compared sun exposure behaviours to mortality. And the different shades of grey you can see here in the graph represent different causes of mortality. And this first graph shows the mortality over a 20-year period in those with the most active avoidance of the sun. This is the group with the most active sun exposure. And you can see even further a larger reduction in mortality. The more sun exposure we have, the more likely we are to have skin cancer. But on the other side of the coin, UV radiation is associated with a reduced risk of about 14 other different types of cancers, as well as reducing the risk of heart disease and diabetes. Let's have a look at a study that looked in particular at skin cancer and mortality. So this graph here compares the mortality rate in those with a diagnosis of melanoma skin cancer compared to those without a history of any skin cancer. So the light grey line here shows those with melanomas, and the darker line here shows people without any skin cancer. And you'll notice that there's very little variation between the two groups. What about non-melanoma skin cancer? You can see here in the light grey line that those with non-melanoma skin cancers, on average, lived longer than those without any skin cancer. You can see there's almost 10 years difference between the two groups. Even in the presence of skin cancer, sun exposure might be beneficial. Ultraviolet radiation has a smaller wavelength than visible light, and we divide it into three categories: UVA, UVB, and UVC. UVA, which you can see in yellow, easily penetrates the atmosphere, and most of it reaches the ground. In contrast, a lot of the ultraviolet B radiation is attenuated by the ozone layer before it reaches the ground. The thicker the layer of atmosphere that it passes through, the less of it that will end up striking the ground. So when the sun's directly overhead, it's passing through the shortest amount of atmosphere before it reaches us. So we're getting relatively proportional amounts of UVA and UVB exposure. But when the sun is lower in the sky, as in earlier in the day and later in the day, the UV radiation passes through a much greater mass of atmosphere, and especially the ozone layer. And this mostly affects UVB levels. So you can see here in this graphic that when the sun's coming up in the morning, the amount of ultraviolet B radiation is actually far less. This is the main cause of sunburn, and it's the principal cause of skin cancer. Both accumulated UVB exposure and intermittent intense exposure have been shown to contribute to different types of skin cancer.
Accumulated UVB exposure and intermittent intense exposure contribute to skin cancer.
On the other side of the coin though, UVB is what leads to the production of vitamin D in our skin from cholesterol. And it's this vitamin D that many people attribute the health effects of the sun to. But as we're about to learn, while vitamin D is really important for our bone health, it doesn't significantly impact our lifespan. UVA, in contrast, is far less implicated in skin cancer. To a degree, it can cause a slight increase in risk, but much less than with UVB. It does play a role in skin ageing, and it might also contribute to wrinkles. UVA radiation releases a substance called nitric oxide in the skin. And this is a substance which actually helps you live longer. I'll repeat. UVA radiation releases a substance called nitric oxide into the skin. And it's this nitric oxide which explains the link between reduced mortality and sun exposure. These pictures here show how nitric oxide is increased by increasing exposure to UVA radiation.
UVB produces vitamin D in our skin, but vitamin D does not help our lifespan, although it does help our bone health. And UVB causes skin cancer. UVA produces nitric oxide, and nitric oxide extends our lifespan. UVA is not implicated in skin cancer.
The problem is vitamin D just doesn't explain the increase in lifespan. It is incredibly important for bone health, but it doesn't give us the huge mortality benefits that we saw from the other epidemiological studies. So where does vitamin D come from? Well, we can get about 5 to 10% of our daily requirements from food. Now, very few foods naturally contain vitamin D. Fatty fish, liver, and eggs, so another source is needed. That source is the sunshine. UVB rays strike the skin and convert cholesterol in the skin to vitamin D. And it's also, when the sun strikes the skin, we get a little bit of UVA exposure, and that produces nitric oxide. But as we said, vitamin D could be predicted to be associated with all-cause mortality because it's also associated with nitric oxide release. And this is indeed what we see. This graph here is from a meta-analysis, and what you can see is that in those with a low vitamin D, the risk of dying is almost double that of people with high levels of vitamin D. Well, let's see what happens when we give vitamin D as a supplement. This was a study of more than 2,600 subjects, and the two lines here measure the death rate. The higher the line, the higher the death rate. And you can see there's virtually no difference between the supplemented group, represented by the solid line, and the placebo group, represented by the dashed line. And this finding has been replicated many times. Vitamin D is probably not the answer. Let's take a closer look at nitric oxide, the substance that's released in the skin in response to UVA exposure. This is a study in which participants were exposed to either real or sham ultraviolet radiation of the UVA type, and the effect on blood pressure was monitored. And you can see here that the real UVA exposure in the lower line led to a much more significant drop in blood pressure, and this effect occurs because nitric oxide, which is released from UVA exposure to the skin, actually relaxes our blood vessels. Now, nitric oxide also benefits our blood glucose level by improving the sensitivity of insulin. And high blood sugar is known as a risk factor in many diseases, heart attacks, stroke, dementia. So then, we might predict that blood sugar control would be better in summer than winter, and that's exactly what we see. This is a measurement of average blood sugar using a test called HbA1c, and that measures how much glucose is in the circulation over a period of about 4 to 6 weeks. And this graph from a Northern Hemisphere studies shows that HbA1c is significantly lower in the summer. And understand that HbA1c is one of the most powerful markers of disease that we have. A reduction in HbA1c is very significant. If indeed nitric oxide lowers our blood pressure and improves our blood sugar control, the question is, how do we get more of it from sun exposure while minimising our risk of skin cancer? Now, remember, when the sun's lower in the sky, we're receiving proportionally more UVA than UVB, and it's that UVA that produces more nitric oxide. It then makes sense to expose ourselves to the sun more when the sun is lower in the sky. Now, what happens if you're outside and you don't know what the UV index is? Well, you can use the length of your shadow as a pretty good surrogate marker. Remember that when the sun's low in the sky, you're getting proportionally more UVA and less UVB. Generally speaking, if your shadow is as tall as you are, you should be able to spend at least half an hour in the sun without any protection. I want to now move on to one of my favourite topics, omega-3, found in fish oil. In this study, 15 volunteers took high doses of fish oil for up to 6 months, and the effect was significant. So effectively, that meant that you could spend twice as long in the sun without getting burnt. And there's another benefit of omega-3 fat supplementation which is very relevant to skin cancer, and that's got to do with the immune system. It can also play a role in identifying and neutralising abnormal cancer cells. So anything that leads to impairment of the immune system potentially increases the risk of cancer. So the immune suppressant effect of UV on the skin is really significant when it comes to skin cancer. And in this study, they explored the immune suppressing effect in people taking fish oil and those without. It was a study of 79 females. And what they found was a significant reduction in the immune suppressing effect in those who took fish oil for 3 months. And this is a combined meta-analysis and systematic review on the risk of skin cancer and omega-3 supplementation. And it found that the consumption of high levels of omega-3 fats was associated with a 48% risk reduction in melanoma. And it's at this point of the story I'd like to introduce a villain. This is vegetable oil, except it doesn't come from vegetables. It comes from seeds. The problem is vegetable oils are very rich in omega-6 oils. Omega-6 oils are shown here in yellow, and you can see that vegetable oils, by and large, have very large quantities of them, and correspondingly, very small volumes of omega-3s, shown in orange. And the problem is that omega-6 fats are quite harmful in skin cancer. They increase the production of, among other things, something called the series 2 prostaglandins, and these increase the inflammation and carcinogenic expression within the skin in response to ultraviolet exposure.
Omega-6 increases inflammation and carcinogenic expression in skin during UVB exposure.
Omega-3 fats, on the other hand, they lead to the production of series 3 prostaglandins, which inhibit these processes.
Omega-3 inhibits inflammation and carcinogenic expression in skin during UVB exposure.
And if we increase our omega-6 level, well, this leads to a reduction in our omega-3 level.
If we increase our omega-6 level, this leads to a decrease in omega-3 level.
Let's take a look now at how we can use the relationship between omega-3 and omega-6 to our advantage. This was from a dietary intervention study. No supplements were used, just changes in diet. And in this part of the study, participants were placed on a low omega-6 diet, the kind without vegetable and seed oils, no margarine. Let's first of all look at the omega-3 index shown here in white. And what we can see is that over 12 weeks, the omega-3 fat EPA in our red blood cells increased by 21%. And if we have a look at the omega-6 levels in red, we can see there's a corresponding reduction of 26%. All in all, that's not too bad, but it's not amazing either. Let's see what happened when we increased the omega-3 intake. Now we see a massive increase of omega-3 of 271%, and nearly double the reduction in omega-6 of 50%. And remember, these changes occurred with diet alone. No supplements were used.
A high omega-3 diet can significantly reduce the levels of omega-6 in our system.
So the combination of both reducing omega-6 and increasing omega-3 is very effective, and almost certainly will help to protect from some of the damage caused by ultraviolet B radiation. So let's recap what we've covered today. The UVA radiation from sunshine releases nitric oxide, which seems to be associated with a mortality benefit. It's mainly ultraviolet B radiation that causes sunburn and most of the skin cancer risk. And we can reduce our exposure to UVB while still getting enough UVA by exposing ourselves to the sun when it's lower in the sky. And getting the right balance between omega-6 fats and omega-3 fats seems to be incredibly beneficial, reducing our risk of melanoma and also increasing our resistance to sunburn. So in closing, appropriate sunshine exposure is actually good for our health, and militantly avoiding it probably causes more harm than good. Broadly speaking, we can put fats into one of two categories, what we call the saturated fats and the unsaturated fats. So when we're talking about the saturated fats, they're the kind of fats which are found in animal foods. So if your dairy and your meat and your eggs. The balance of research, including multiple high-level meta-analyses, which is a distillation of all the evidence together, would seem to indicate that saturated fats have no deleterious effects on your health at all. And in actual fact, there was a very large study of over 100,000 people on 5 different continents looking at saturated fat intake and people's chance of dying, what we call the all-cause mortality. And what it seemed to indicate was that as your saturated fat intake went up, your lifespan increased. And there was no threshold beyond which saturated fat intake was shown to be harmful in any way, which then brings us on to the other classes of fats, which are called the unsaturated fats. We can put these unsaturated fats into one of two classes again, and that's the monounsaturated fats, which simply means there's just one spare bond, or the polyunsaturated fats, which means there's more than one spare bond. Now, monounsaturated fat The fancy name for it is called oleic acid or an omega-9, but it's more commonly known as olive oil. So olive oil is very rich in monounsaturated fat. Balance of research would suggest that olive oil doesn't have any adverse impacts on the health at all, and I think most doctors would agree that consumption of olive oil is absolutely fine. We've got two main classes of polyunsaturated fats, what we call the omega-6 fats and the omega-3s. Now, the omega-6 fats are found in vegetable and seed oils, and they actually have been shown to be pro-inflammatory. High intake of these omega-6 fats actually has been shown to be deleterious to the health, and there's a lot of research that will point to this. Now, the omega-3 fats, on the other hand, come from fish oil, and they get metabolized very similarly to the omega-6 fats, but they're nowhere near as inflammatory. In actual fact, we could probably argue that they're anti-inflammatory. And the problem is that in the modern diet, we have an imbalance between these omega-6s, which are pro-inflammatory, and the omega-3s, which are anti-inflammatory. So what actually happens, our body produces these chemicals, they're called eicosanoids, and they communicate around our body to, stimulate inflammation or stimulate the immune system or stimulate a fever or various different things like that. When we make these chemicals, these eicosanoids, we'll randomly use an omega-6 or an omega-3, and these fats are in every cell membrane. And if we have a lot more omega-6s in our cell membranes than our omega-3s, then we're going to be in an inflammatory state. So it's not enough to simply increase the amount of omega-3s in our diets by supplementing with fish oil. We also have to have a concurrent reduction in the amount of omega-6s. We have to reduce the vegetable and seed oils in our diet. And one of the big problems when we actually have a look at the research on, we argue, is fish oil beneficial to our health or not? A lot of the studies will give people omega-3 fish oil, but at the same time, they'll increase the omega-6 in the diets. They'll say, well, you need to cut out the saturated fats, which we know are not harmful, and increase your vegetable oils. So what we're doing is we're not changing the ratio at all. And it's this ratio that we need to change to improve. And that's why a lot of your viewers are probably going to be a bit confused, because they see all these studies saying, oh, fish oil didn't seem to work. But it's what else is going on at the same time in those studies. It's one thing to increase the omega-3, the anti-inflammatory fat, but if you increase the inflammatory fat at the same time, well, you negate that effect. But in my patients, what we do a blood test where we measure the percentage of the cell membrane that is actually the omega-3 fat. And what we find, we can usually get more than a doubling of that percentage by reducing the inflammatory vegetable oils and supplementing with a reasonable dose of fish oil. For a long time, I used to believe that omega-6 fats were inherently inflammatory. And now I don't, because if we actually look, there's studies of supplementing with arachidonic acid and this kind of thing that actually shows that it actually enhances muscle bulk and muscle strength, and they don't appear to be negative in the right situation. And the right situation is a low inflammatory environment. So the problem with omega-6s, or the problem with our old thinking, was that we thought you ingest this omega-6 fat, and then it gets turned into arachidonic acid, and then that arachidonic acid can be turned into these inflammatory products downstream. Arachidonic acid is not converted into these inflammatory products in the absence of an inflammatory stimulus. So if you're in a low inflammatory state, your arachidonic acid is just sitting there, and it can produce good things, but it won't produce these bad things. And in actual fact, when we put people, there's one study I know of that actually looked at arachidonic acid levels on a low-carb diet, which we know is a low-inflammation diet, and they actually found that arachidonic acid levels increased. And that fully supports this view that there's less conversion of arachidonic acid into these negative products. And the reason that all these vegetable and seed oils are associated with bad health is not, in essence, because they're high in omega-6, it's because they're high in oxidized products. So when you have any fat, for it to be liquid, it has to have double bonds between carbons. The more double bonds, the more liquid it is. So basically, the liquidity or solidity of a fat is proportional and a good surrogate marker for how saturated or unsaturated it is. And any fat that has these double bonds between carbons is prone to oxidation. And that can be omega-3 fats, just as much as omega-6 fats. And this is critical to understand because people supplementing with fish oil, they're not necessarily doing themselves a service. And they did a study a couple of years back in Australia, so went around to 2 different pharmacies in Sydney, local here, and bought all the available fish oil supplements that didn't have additives to them and measured their oxidation state. And every single one of them had was oxidized. So fish oil is not safe. So the premise is that if you want to avoid oxidized fats, then you better get it from food, because the definition of oxidized fats in food is rancidity. If you are not going to eat something that's rancid, then you're probably not going to be ingesting high levels of oxidized fat. So if you want your omega-3s, have some salmon that's not rotten. Have some grass-fed beef that's, that's fresh. So, and you'll also get your omega-6s this way as well. And the problem is that when we ingest, say, if we have a vegetable or seed oil, this just forms the largest part of oils in our diet, and that's why we get most of these oxidized products. They get absorbed through our chylomicrons. They attack the liver. We also know that these oils are oxidized incredibly quickly. So even within a matter of hours, there was one paper I read on walnut oil, and I think it was tested 6 hours after harvest. It already had significant amounts of oxidation. So even if you're buying, single press extra virgin olive oil that's kept in a cool cupboard that's in a brown jar, it's not going to be enough. It's still going to be oxidized. And olive oil is something that surprises a lot of people. Remember, we said it's liquid because it's got a double bond? Well, 70% of olive oil is oleic acid or omega-9, which has a single double bond, and that double bond is still prone to oxidation. So even olive oil doesn't get a pass. So if you want to work out what the safest oil is to have, or safest fat, well, the basic thing is it should be solid at room temperature. The more solid it is, that's a really good surrogate marker for the less double bonds, less prone to oxidation. And one more key point here is you have to strictly control your blood sugar levels. I did a study looking at oxidized oil intake and how much was actually taken up into the body in a group of well-controlled diabetics and poorly controlled diabetics and healthy people. And what they actually found is that the level of oxidized products that ended up in your system in the poorly controlled diabetics was significantly greater, order of magnitude greater than in people who were either well-controlled or didn't have diabetes in the first place. And we know this makes sense because fluctuations in your blood sugar levels actually does generate oxidative stress within the mitochondria. So we've got evidence of this as well. So what I'm now recommending for my patients is that they avoid any liquid fat, including fish oil. And if they want to make sure they get their fish oil, it's got to be from fresh food. And that includes not having olive oil. And if they still are having any oils at all, it's absolutely essential that they have strict blood sugar control.